All right. And we are live now. Okay, green checks across the board. Excellent. Yay. Welcome, everybody. We're talking about myths about mushies today. We have kind of we're not calling ourselves experts. We're saying people who know a lot about psychedelics and mushrooms and have a lot of experience. So we're going to talk about myths and FAQs today. Let's kick it off with some introductions on who we are and why we're kind of qualified to speak on this. So my name is Megan. I'm the founder of Trusted Canna Nurse. I have a little bit of experience with microdosing. I started my own journey back at the beginning of this year. Ariane has helped guide me on my microdosing journey, and I've kind of, I've created content around that ever since then. And then I've since brought Ariane on board to help our patients on their own microdosing journey as well. So I am speaking from what I have learned in the evidence and through my own personal experience. So that's what I bring to this table. Quinn, who the hell are you?
I am, and if there was a PhD for drug addiction, I would have like 3. I've done every psychedelic, every mainstream psychedelic, and I also have suffered for a long time through coke and heroin addiction, went away from the plant medicines throughout being lost in addiction, and then rediscovered the of plant medicines when I got sober. And ironically, having this spiritual awakening through my psychedelic experience allowed me to lose the obsession of escaping through coke and heroin. So I have quite a bit of knowledge on psilocybin and microdosing and the whole spiritual awakening behind it. And I think it's really fascinating that you mentioned, Megan, that after you had your journey, you kind of started to base your social media around this experience you had, because it is such a profound thing. And for me to have gotten out of my 18-year coke and heroin addiction because of this spiritual awakening that I found through psychedelics just goes to show that it can be a life-changing experience. So I love that you mentioned that.
Can you see me?
Loud.
Sorry. I was just kidding. I was trying to do something.
All right, you two, go ahead. This is awesome.
You going?
Sure. Thanks for joining for a very casual conversation. As you can see, my name is Ariane Williams, and I am the Director of Patient Care Services at Trusted Canna Nurse. Been a nurse for 16 years, and I help people with holistic health and wellness coaching right now, utilizing a variety of different plant medicine. I have a lot of personal experience of using psychedelics, both recreational, spiritual, and therapeutically, to help my healing over the past few years. I have a history of, struggling with alcoholism and the American dream. Excuse me, I did that. That's kind of what it's turned into, right? Like, to be honest, it's like you go to work, you got to be stressed out, and like, it's okay to drink every day and, drown your sorrows in the bottom of a bottle because that's what everybody else is doing, and being sick on antidepressants, because I was on antidepressants for 15 years, and psychedelics have really changed a lot of that for me, along with, doing mindfulness practices and getting better in touch with who I am, supporting me and just living a more easeful life that doesn't feel as strained or fast-paced. But I've done training with at Sound Mind in Philadelphia for ketamine, MDMA, and psilocybin assisted therapy. I've also done training with cannabis for cannabis assisted therapy, and psychedelic cannabis use, conscious cannabis use, medical cannabis use, whole slew, right? So I'm not an expert. I do know a few things. Been helping people in the psychedelic space for a couple of years, and it's been really awesome. Heather, who are you?
I'm Heather Shelton. I am a newly retired nurse, proud to say, actually. I have been working with plants of all kinds. I've been becoming an herbalist since I was 21 years old, and I live my life with plants. So I've left nursing a couple years ago, but retired this year, and I've been spending the majority of my time working as a cannabis nurse and working in a ketamine clinic, which was a really great experience. Actually, I had 2 different ketamine jobs, and now I just helped a friend open the first legal psilocybin service center here in Oregon, first in the nation, which has been a kind of a wild journey. With all kinds of unexpected things like media and stuff that we didn't know were going to happen. So it's been really a big project. We are now serving clients. That's been really incredible. It's, so that's what I do now. And we did a lot of plant work today in my gardens. Ariane's visiting me in Oregon, which is great. And it's about time that we start to put our gardens to bed. And we just harvested actually our cannabis crop and lots of tomatoes and lots of flowers and things that'll be dry for the winter.
Lots of things I like to eat.
Yeah.
It's
Yeah.
been amazing.
Amazing. All right. So let's get into this. I have a pile of questions here, and so does Quinn. So we'll just kind of go back and forth. I think that we should kick it off by addressing one of the major ones, that like psilocybin still remains Schedule 1, which means it has high potential for abuse and no therapeutic use, minimal therapeutic use. So let's just, what's that?
No medicinal benefit.
No
right?
medicinal benefits. That's what it is. And high potential for abuse. So let's kick it off with like the facts around psilocybin's. Oh, this is educational purposes only, of course. This is not medical advice. But let's kick it off with the evidence on like addiction and psilocybin, and can people become addicted to mushrooms? Is that a thing? And I don't know who wants to answer that. It doesn't meet the Schedule 1 requirements.
It doesn't meet the Schedule 1 requirement. What's interesting is that psilocybin doesn't necessarily affect like dopamine, right? So it doesn't create that dopamine fix, which is what is a lot of times seen when you have addiction issues. So that kind of helps eliminate that, if anything. When looking at it, I mean, could it turn into a habitual use? Maybe. Are you going to microdose every day? I really doubt someone's going to be taking large journeys every day. And to be fair, I don't know what Heather's experience or even you could speak on this, but if you keep going to the medicine and to the bigger experiences enough times, at some point it's probably going to tell you to stop coming, right? Like, especially if you're going looking for answers around certain things in your life, and if you keep going back for the same thing, and it's going to be like, why are you here? We've already told you what to do. Why haven't you integrated? Why haven't you done what you were supposed to do with what we told you in the first place?
Well, I think that's a very important thing to bring up, is that, in asking if people are going to get addicted to microdosing and want to take microdosing all the time. I mean, what we can say is that people have the most therapeutic effects when they're having support when they're microdosing. And so really, I think that all of us in this group right now would say we would recommend doing some therapeutic work with microdosing and not just using it as something to make you feel better every day. I mean, that is an awesome benefit. And also when we are feeling a little better, especially, if like, I know for me, when I'm depressed, it's harder for me to do the self-care things, right? So if I can feel a little better, then I'm able to use those tools. So having some support and knowing what those tools can be for yourself is really helpful. So I think that really decreases the outcome of addiction with psilocybin. And I know, of course, we can get addicted to anything. I mean, there's all kinds of things, not only chemicals that we put in our body, but So anyway, that's my input.
I think that's
And I just want to also say about the Schedule 1, cannabis is also still a Schedule 1 drug, and we are very aware of the fact that cannabis is medicinal for so many people and helps manage so many different conditions. And we've already seen in the research, right, our evidence-based research, which is so important in the world to know, that psilocybin is actually helpful for people. And so there is medicinal benefit, right? So it doesn't fit into the category based on that. So, yeah.
All right. Thank you. Thank
Yeah.
you. Quinn, what about your experience, having a history of addiction and turning to microdosing and macrodosing?
Yeah, it's quite interesting because when I got sober, I I started hearing about microdosing, and I was considering it as an alternative to all the pharmaceutical drugs that they wanted me on. I had to really be honest with myself, and I had to ask myself, is me wanting to do mushrooms or THC, is this just my addict side wanting to escape, wanting to find some like, weaselly way into using drugs that was like more acceptable by society, and that was like my way of, getting around being able to get high without being judged. And that was something that was really indoctrinated on me in like the 12-step program of like abstinence, that you have to be abstinence for your sobriety to be valid. And so that was a crossroads that I had to come to, and decide for myself, am I using this to escape? Am I using this to numb and validate and do the addict behaviors that I'm used to? Is this the addict side of me trying to get high somehow? Or am I really trying to figure out like an alternative? Right? Am I really trying to find a way to heal? Am I trying to, get answers? And for me personally, I know that when I was in my teens, like my want or my obsession towards the need to like escape or validate or numb absolutely came through smoking weed and doing, drugs that are a little bit more acceptable, drinking alcohol underage, doing mushrooms and ecstasy and going to raves, festivals and stuff. And absolutely, I got addicted to going to raves, taking ecstasy and having this freaking out of body experience that like opened my mind to like all these different like perspectives and stuff. And yeah, absolutely, I got addicted to that. I think once I had experienced what those psychedelics could do at a young age, I didn't understand the healing benefits of it. And at that age, when I was searching to escape and numb and validate and mask and all these things, my addiction was the obsession, and not necessarily the substance. So can you get addicted to psilocybin or weed or plant medicines, kratom? Absolutely, 100%. Um, but it's not the physical addiction. It's the mental addiction. It's the obsession, like I'm talking about. It's not the substance itself. So if you're wanting to escape, yeah, you can find escape in anything. You can find escape in overeating. You can find escape in toxic relationships or freaking purging and whatever, cutting, So it's really about observing yourself, being honest. Like, am I doing this to heal or am I doing this to escape? And when I got to that crossroads after an 18-year addiction to coke and heroin, I was like, okay, I've done the whole freaking experimenting with the other realms, and I've done the freaking, just tripping balls and all this stuff at raves and whatnot. What I'm trying to accomplish right now is I'm trying to find a way to subconsciously speak and reach the inner child within myself and have those real important conversations. Why do you choose to escape? Why do you hate yourself or feel worthless? Or why are you, why is this obsession to numb your traumatic events? Or or to mask who you are? Why do you feel the obsession to do this? And psilocybin had at that moment really helped me to be able to come face to face with that, you know, or at least I have a lot of intrusive thoughts, you know, and we get really good at ignoring those intrusive thoughts. But if you sit there and just pay attention for a second of what those thoughts are saying, and you're not comfortable with it, but we're just overlooking it, it's just getting compiled on to all the other things that we're dealing with in life, and it makes it hard to continue your life and be, you know, happy and not depressed. And so my macro journey made me face to face with all the things that I had been running from. And once I was face to face with it and I had to answer those hard questions, and I had to like deal with the traumatic past and had the intention of healing and really getting to a point of understanding, then that was, for me, that was the goal. It wasn't to escape, it was to heal. And so I was like, okay, you know, and from that experience, I got away from addiction, which is ironic. And people tell me, oh, like, how is, you know, THC and psilocybin, how is that sober? And for me, it's a lot like, it's you can just kind of compare this in the sense of mental health. You know, somebody who needs mental health medications, to tell somebody who needs mental health medications, hey, you can't take that or you're not sober, it's the same as medical marijuana. It's just that, you know, marijuana has been so demonized and everything that we're like, oh, because it's a plant and it's not in pill form, then now you're not sober, you know. So to answer your original question, yes, I do believe it's capable of being addictive, but not physically addictive, more so in the like mentally addictive to the obsession of escape. And I think that's really important to understand. But like I said, you know, it can be anything. We can be addicted to food, we can be addicted to toxic relationships, and it's really our relationship with those things that needs to be evaluated. And transparency and honesty is really honestly the best way to go about it, you know, with yourself.
Which is like really mindfulness, right? It sounds like you transformed into a more mindful relationship of like, why am I doing this? What, you know, why? So when, you know, we don't recommend people just eat mushrooms every day, but really part of the journey of using microdosing for healing is that we learn and practice some of those tools and are able to lift up maybe sometimes out of a heavier space, to feel like we can actually put those tools into practice. And so,
Yeah, love it. All right, Quinn, what's the question, one of the questions that you got?
So somebody had mentioned that they didn't feel much from microdosing. Obviously, you know, that's the goal, is that we don't feel much from microdosing. Like, we don't want to be taking something and walking around being high necessarily. And I tried to explain to them how microdosing was more like taking a vitamin, where you're taking something like vitamin C and you know it's good for you, you know it's working, you might not feel it, you know, and it might not hit you like something like a drug of whatever, but it is still working. And so they wanted to know, what is the difference between microdosing and macrodosing on like a beneficial level, not on a like what do you feel trip kind of level, but like in a beneficial level, like for the body, like what's happening.
I love that question. It's a great question. I think that it's really interesting because microdosing can be so subtle in the changes that you don't really see it. tracking can be really helpful. When I'm working with people and I do my check-in weekly and we're talking or whatever, a lot of people just think that it's like a mental thing that you're going to see shifts around, but sometimes people's physical bodies can actually feel better. And it's the subtleties that they don't realize. Like, how have you been sleeping the past week? Right. How's your body felt the past week? If you have, chronic pain, how has that felt for you? How have your interactions with other people been? Because the things can be so subtle that sometimes people don't see it until they step back and they're like, oh, wow, like maybe things are a little different. One of the things that I found to be kind of fascinating is like in the microdosing space, like where people aren't really feeling anything, right? And they're like, I don't really know if it's working or not. And then I check in with them a couple of we check in and it's been like 3-4 weeks or whatever. And they're like, I realized that I'm not drinking as much alcohol as I used to. And it wasn't intentional. Or I'm not smoking as much cannabis as I once was. And it wasn't intentional. And it's because I feel like those are grabs for people, to help when you're feeling anxious, you're feeling overwhelmed, whatever. We all have this ritual or this trigger, this activation that tells us like, this is what we need to do now. But if that voice is a little bit quieter and you're at a state of like more ease and contentment, whether you realize it or not, like little things like that may fall off. And so that's like seeing it from a microdosing standpoint is that it is subtle changes and it is like a supplement for your brain, right? For your nervous system. And sometimes like you don't really see the changes until it's been a minute or until you take your tolerance break, your break, which is what I call like a reflection break, because sometimes you don't know if the medicine's actually worked until you're not in the medicine. Especially when we're talking about nervous system regulation, right? If someone is coming and they're just like super anxious and hypervigilant around things, like always wanting to nitpick and control their environment. Like it has to be picked up. We can't leave this out. Can't leave that out. Just that whole thing going on. And then they realize like, oh, like that's been sitting on the counter for a week and I didn't say anything about it and it's not bothering me. Right. And it's like the little things that can occur with microdosing. When incorporating mindfulness into it, you may see a little bit more quicker, right?
Well, you will because you're just starting to practice mindfulness,
right.
Which on its own really can make a difference.
I don't like to say like absolutes, right?
Right.
Because I don't want to give anybody expectations, right? Like
no expectations.
Well, no
we're
expectations.
All unique and we all have our own way we're going to do it. It
may be helpful if you incorporated some mindfulness, right? The invitation is there if it might feel good. But whereas like going into the macro space where you can have this like profound realization or this insight around something that's really big that's occurred. And then you come out and you start like making the changes, right? You no longer want to smoke cigarettes because you just had this like intense experience with like in your macro dose where you just don't want to do it anymore, right? Or you might not want to drink alcohol anymore. Does that mean that you're not going to start smoking cigarettes or you're not going to start drinking again? No, this is where integration comes into play. This is where having therapy or a coach or a support group can help. Even in the macro spaces, but I kind of tell
even more in some ways.
What
in the macro spaces?
What having the integration is for? I think it's pivotal. Like if you're not integrating things, and that's why I said like especially you can keep going back, and it's
for people who are new, who haven't ever experienced that before.
And even if you have, like it just you get a lot of bigger messages in those spaces.
I just wanted to chime in about something that you were saying about microdosing and how it can be really subtle. Is that's the way of plant medicine, guys. All the plants are like that. Oh, I'm sorry.
No, I'm saying it's a quiet medicine.
Oh, yeah. And so CBD, like, I mean, here we are, Trusted Cannoner. She's got awesome CBD products, right? And you know, some people have dramatic, oh my God, they take like 2 doses of CBD in a day and they can feel really that their inflammation has decreased, or they can feel an immediate change. But for most folks, you got to use it regularly for a little while to tell if it makes a difference. And we recommend people track, right? And that's ways you can tell what's happened. And I still do this, right? Where, oh, I stop for doing whatever I've been doing for a while, whatever the herb is. Sometimes it's oats, right? Or nettles or other plants too, because all plants, our bodies work together. We've been doing this a long, long time. You know, I'll stop taking it and then 2 weeks later, I'll be like, oh, that was working. Why did I stop taking that? You know, I think there's a little human nature about doing that. That sometimes we need to take that little step back to see how it's affecting us, you know.
Yeah. And I'll add in too, like the difference between micro and macro. Microdosing is like going to the gym and, you know, you're working out, you're going to see small changes over time. Other people might notice changes in you before you notice them, things like that. Whereas a macrodose is kind of like going in for a knee replacement, that like overnight everything has shifted and you have this new knee now. So then
you have this new knee and you have work to do.
And you have, and you
right?
still have to like
Psilocybin can show you the door and you still have to walk through it. And that's like what integration is like, and that's where sometimes having support to figure out the best way to walk through that door, you know?
Yep.
And although I will say, don't make any drastic changes 30 days within a giant psilocybin. Just good to kind of give yourself a little time to make sure that whatever drastic life change, like leaving your wife or
that's a good tip. So
house or some, you know, moving,
selling your house, leaving the
yeah,
country, dropping out of school.
Just good to like integrate a bit before you do this. Because sometimes that is the message.
All right.
Anyway.
Cool. Quinn, anything you wanted to add on that?
As far as for me, well, I mean, the question was, what are the benefits between the micro and macro? And I don't know exactly, like on a chemical level, what it is. I do know that, yes, I do agree that micro is more like a subtle changes, whereas a macro is like a big, like kind of like a big reset. And I guess you kind of have to judge like what it is that you're looking for. Are you looking to, you know, are you coming off of a 18-year coke and heroin addiction and you freaking don't know how to live a normal life, and so you need like a whole brain reset to kind of reinvent yourself? Or are you living a pretty like typical normal life and you just are struggling with, you know, depression or anxiety, or, you know, you might have like disorders or something like that, and you don't need a brain reset. You kind of just need to like put things into perspective. I think that, you know, those are kind of the differences. So yeah, definitely.
Yeah. And I'll add too, microdosing, you can usually go about your day. You may or may not feel anything. And you can take a microdose and go and about your day. But a macrodose, that's something that you are setting aside a block of time. And it could be a couple of days surrounding this macro dose. And that's really important. That was a mistake I made on like my first macro dose. I mean, it was only 2 grams, so whatever. But yeah, I had to come home and be a parent after that experience. And that was really, really challenging that day. So I love my kids, but that's like, you want to set aside time beyond just the block of time that you're in that space, but you want to set aside time after that to reflect and not have all of these other things going on.
And, you know, I think that's a really important point. And so one of the things I recommend to everyone who comes to the service center is to make sure, you know, we talk about that, having some time off the couple of days afterwards so that you have space to integrate and to kind of come to recognize what some of those insights might mean for you. And, you know, we live here in Oregon, which is this beautiful mystical place. And so I encourage folks to stay for a few days and hike the butte that's here, or go to the ocean that's an hour away, because I think there's this gift for psilocybin that helps to bring us back to nature in some ways. And then there's so much healing that we need and we can do in that space. And the earth needs it too. I mean, this is like, I really feel that this is an important piece of why psilocybin, how we have this, how we're moving in this direction, the more people are able to have safe access. Which I don't think is the only way, but that's what we are doing in Oregon, and it feels good. So yeah, anyway, I think it's really important with the macro doses, and I hope for lots of people. I mean, I would recommend getting outside with microdosing too as something that
Definitely
just to support that work happening.
Yeah, awesome. All right. Okay, I had a question on my stuff about pregnancy and breastfeeding. How do you guys approach? Quinn, how do you approach that?
100%.
I kid. This one's for Heather and Ariane. How do you approach it when people come to you with questions about pregnancy and breastfeeding? Is it passed through the breast milk? Is it passed through the uterus? What do you tell people?
I'm going to respond to how we handle that in a legal way here in Oregon, because I'm a representative of a legal service center, is that that is a question we ask people in the beginning when, are you pregnant or feeding with breast milk? And if somebody responds yes, and this is our direction, this is a question we have to ask through the state. There is no research about using psilocybin when you're pregnant or breastfeeding, feeding with breast milk. So it's not a hard no in our state, and I will, not through our service center, but just through my life. In the last year, I've met 3 or 4 moms who have microdosed rather than have to use pharmaceuticals to manage their mental health challenges while they're pregnant. So that's all I can say. But right, and it's a benefits and risks question. And for some people, like for me, pharmaceuticals are a very last line in the way that I'm going to provide care for myself or my family. I'm sometimes they're necessary. I absolutely know this. Been a nurse a long time too, but I like to choose other things. And for some people, those pharmaceuticals have really bad hard side effects, or they don't work. And some of them actually have known adverse effects in pregnancy. So, I encourage mamas to do their research and do what feels right in their heart. So
it's the same thing I do. I do education as far as like there's no research around it, and also like education on the side of the medicines that are currently used that are, safe. Here, I was told like, oh, well, they put me on the safest one for pregnancy, right? And stuff like that, and it's just
class C or something. I mean, I'm actually a little out of practice with my drug guide, so I can't remember all the. I mean, you might know Megan because you're an L&D nurse, but I'm pretty sure. I think they're like class C, which means there are known side effects and there's potential for harm, but they're not a black box,
right.
Which a lot of the meds have that.
Right. And I think it's important to note that historically, psilocybin has likely been used a lot in pregnancy and postpartum. I don't know anything about
as
that.
Part of the culture in other cultures, absolutely.
Yeah. I mean, I know that
like
when
cannabis.
up into certain trimesters, like women still doing ayahuasca, or like within certain trimesters doing like peyote or wachuma, and it's a part of it, right? And even utilizing some of these like master teachers for their delivery as an aid to help with relaxing into the experience and allowing the body to really be what it is, which is this beautiful machine that knows what to do when it's time for us to have babies, So it's really interesting, all the things that are out there.
Awesome. Thank you. All right, Quinn, you're up. What's the question you have? Or a myth?
Somebody had mentioned, I've heard it can go both ways. You can either have a good experience or a bad trip. I'm interested but nervous to try it. Heard it can help with anxiety and PTSD.
So the
I
good
guess
trip, bad trip?
Yeah, the question, I mean, I guess this was more of a comment, but I thought it was a good topic. The good trip, bad trip topic of whether you even can have a good trip or bad trip on a microdose, and what exactly a good trip or bad trip like is.
We're back to microdose. Yeah.
Yeah, you can, and I think that a lot
What
of
does
it,
that look like? A bad day?
it looks like a bad day. It looks like a bad day. It might look like more anxiety. It might look like more sadness. It might look like irritability and not being able to sleep. Right. And again, it's like understanding like dose, what is your intention? What were you feeling like that day? Like what's your mindset? Generally I tell people like, this is not innately a happy pill. It's not like a happy medicine. It's not also like necessarily something you would grab and reach for if you're in a peak of an anxiety attack. Because it does increase your presence and your awareness around things, and it can make you more aware of your emotions, which for some people can be challenging. So, emotional turbulence can happen, and it's not a bad thing, right? I've told people it's like, well, if I've taken like a little too much of a like a little more than a microdose one day or whatever, and like I go somewhere and I see something, even no, I'm going to take that back. It's not even if I've taken more than a microdose. It could be a microdose, and I'm just having a microdose day and then see something that makes me sad, like someone who is homeless or someone in pain, and like I feel it and I get really sad and I cry. Is that bad? No, because I'm having like this emotional human experience that as a reaction to what I'm seeing in the world going on around me.
Which you might have just normally walked right by.
Or if I see a friend and like I'm going to meet my friends or whatever, and it's been a microdose day and I get really excited and then I cry because I'm so happy to see them. Oh my God. Right? Is that necessarily a bad thing? No. But
not everybody feels comfortable crying too. So maybe
right.
That's part of,
it's part of the work.
Yeah. The thing is that really using psilocybin, I used it recreationally as a young person. Those were my first experiences. And so I'm not saying that doesn't have a time and place for folks as well, but like using psilocybin when we're using it therapeutically, like that's what we're hoping to like feel some more, right? Or kind of dig deep, like Quinn said, like I want to dig deep and figure out what the fuck is behind this so I can make a change in my life that I want to have. And so that those answers aren't always gentle, or what we want to see really, because if we haven't been seeing them before, then it's been hard for us to go there. So those can be really hard. And, I would say what I witness most is that even when people have sometimes that hard part of their journey, there's a lot of beauty that comes with it too. And so, I think the risk of having a bad trip, and I'm talking about higher doses again, I'm sorry, I like veered off, but that's what the space I work in. Now I lost my train of thought. Shit.
Good trip, bad trip.
Good trip, bad trip. Well, if
they end up being, there's beauty in the
and there's the lesson, right? And it's still work after. It's still work, which is another really nice time to actually probably access some microdosing to help process through and continue working with those insights and what did we learn, right?
Microdosing after the bigger experiences. But yeah, people can have challenging experiences on microdoses too, and not all microdoses are created equal, right? So what one company or person may label as a microdose might not be. So you may be taking a microdose and then bite off more than you can chew, and that day turns into something that you weren't expecting.
Yeah, I always recommend, I don't know how people are getting their microdoses in this conversation, but something I recommend to folks if you're microdosing from your source of mushrooms, whatever that may be, is to, if you've increased a little bit, like maybe you're doing 0.2 grams of something and then you get new mushrooms, it's just nice to kind of go back to the beginning, a little low 0.1 again, because there are different mushroom varieties and they have kind of different levels of effect sometimes or different energies about them. So just good to get to know your mushroom again.
Awesome.
I don't know. Quinn, what do you have to say about good trip, bad trip? Because I want to hear.
Quinn, you're a little bit quiet.
Sorry. Yeah. I mean, I personally, I've never had what I would consider a bad trip. I've done well over, I mean, I've done macro doses well over 100 times. I've done acid, I've done DMT, I've done mescaline. Me personally, I've never had a bad trip. I've had a lot of very intense trips, and I've had trips where I cried for hours and hours. But I wouldn't consider it a bad trip. Maybe at that moment, I thought that it was like uncomfortable and hard to experience. But once I was done, I was like, oh my gosh, that really had a profound effect on me. I also, I don't know if it's just the way that my body is or if it's because I've done so many psychedelics before, but it takes quite a bit for me to start hallucinating. So it's nearly impossible for me to trip on a microdose or for me to get any kind of feeling from a microdose, like a traditional microdose. We're talking anything under a gram. But that's just for me. I have heard people see like things like moving and things on a microdose as low as a gram. But to me, a bad trip would be like me thinking that like freaking some entity was telling me to like hurt myself or other people, or maybe I was being chased by freaking, I don't know, dragons or freaking cops with 5 heads or something. I don't know. But I personally have never had a bad trip. Like I said, I've had some uncomfortable trips, but nothing that I would consider bad. And I think the most I've taken is 1 time. So that was epic. We were really
Wait,
wild.
was how much it cut out?
A half ounce.
Wow.
Do you remember
Actually,
that?
3 of my friends did it. Yeah, we were basically like laying in the street, and we didn't know if we were like in this reality. I remember my friend Parker, he had these long dreads. He was just laying sprawled out in the middle of the street, and he's like, is this normal? Do people do this? I was like, no, this is not normal.
Just for
Wow.
reference, an ounce is 28 grams. So you're saying you took 14 grams.
Yeah, and I only did that once, but my buddy Parker and what was the other guy's name? There was another dude's name. Can't remember his name at the moment. But they were doing it like half ounces like weekly. They were Robbie. His name was Robbie. Robbie and Parker, who were some of the craziest kids I ever met.
Wow.
So I just want to clarify too, like when we're talking about, because Quinn was talking about larger doses, like a gram is not a microdose. I mean, I know for Quinn it's a microdose, but in the realm of what we're talking about here and like kind of doing microdosing therapeutically, a gram of mushrooms is a more significant dose than a microgram. a microdose. And there is some truth to that for some people. They can have, we're talking larger doses here, and like Ariane said, people can have a bad day on their microdose, which I think is quite different than a bad trip, or at least what a lot of people kind of envision as a bad trip, which, you know, it's the bad trip that brings about the fear, right? And we've all been schooled and propagandized and however you might want to say that word, about all kinds of substances, cannabis as well, right? If you're going to use it, it's going to make you crazy. You're going to like kill your neighbors or whatever, jump off a tall building and die, right? And that's just not accurate. That is actually propaganda that was put out a long time ago and is still societally accepted, really. You know, in larger doses, people can have bad experiences. And like Quinn said, it's hard. Sometimes it's really hard work. It's really hard to work to meet some spots of ourselves, especially if we've been avoiding them for a long time. But it's why you're going into the experience, right? Mm-hmm. And so this is where preparation is really important if you're going to have a large dose. So I just want to cover the large dose thing. Really important to have your tools and be prepared. And just like we're going to do with microdosing too, but really I think the bad trip question comes about larger doses. And so preparation and feeling like you're ready to look at those parts of yourself, you know, and not necessarily be afraid of them. It's okay to be nervous. I mean, you know, that's normal, right? Even those of us who've done mushrooms, like I kind of go in a little like, okay, what's going to happen this time, you know, and I think that's okay. That's respectful. We're like we recognize we can be humble.
And I've definitely been in situations where I was like, you know what, I don't think that I am mentally capable of doing a macro dose right now, you know, and I've waited and I've held off on doing it. You know, and same with my ayahuasca retreat, you know, I was like, the situation isn't right at this moment. And I think that like you kind of get that instinct too, like, is this really what I need right now? Is this like, you know, am I ready for this? And if you tell yourself, no, I'm not ready for this, then I wouldn't do it. You know what I mean?
And part of that's like, who am I with and where am I? Set and setting, critically important. You know, what kind of support do I have? And so in microdosing, like when we're not feeling ready, I like to bring this up because I think that people, I mean, we're here in Oregon where now anyone 21 and over can have access to psilocybin, and that's awesome. I mean, really amazing to allow to like, this is an option for people if they want to have the option. And at the same time, not everybody's ready. Like there's a readiness, you know, and I think some of that is about working through some of the fear. And like we said, mindfulness practices, learning what tools you have. Starting those practices now is a really great way to get ready for a big journey like that. And there is a very small portion, to be totally fair, in evidence-based medicine of particularly young people, and I'm going to say more men than women, just like with cannabis, sometimes if they have a predisposition to schizophrenia or psychosis, it can actually trigger that. So that is true. I've seen that happen in real life. It is not very common and it's not super likely. And it is very often there's a family history of already those psychiatric issues. So I do think that it's important to be respectful. Like, you know, again, we're talking about stability and it is important to have some mental stability and emotional, you know, maybe not as much emotional, but not to take mushrooms, giant doses when you're feeling unstable, I guess. And that's where microdosing can be a really great gift to get the energetics of the mushrooms, to work with the mushrooms, again, with mindfulness and practicing these practices so that you can become more ready for a big journey and less likely to have a quote unquote bad trip. Still hard work, still things you need to do afterwards, right? So anyhow, all right, I'm off the soapbox now. I don't even know if I answered the question. Anyhow.
All right.
I had a question and I forgot.
I'll go quick. And that's why set and setting, of course, matter. But to go on to the next question, somebody did ask that they heard that it depletes serotonin. And I think this also could kind of correlates with this notion that people should, do we microdose every day? How often do we macrodose? And why don't we microdose every day?
I don't know why we don't do it every day. There's no evidence as to one way or the other when it comes to anything like that. There is theory that microdosing every day could possibly lead to hardening of the heart valves. This is just theory. It has not been based in research.
Okay.
With this stuff being federally illegal, Schedule 1, there's not a whole lot of research around things. I don't know if there is an extensive history of people microdosing every day. I think this comes down to benefit versus risk. What are you feeling? I don't recommend to do it every day because generally speaking, most people that I've talked to are able to get good results with doing it a few times a day over, a month and a half, 2 months time, and then taking breaks. Yeah. So, and as far as the macro doses go, I think that's personal choice of how maybe often you want to go into the space, and it's important to do the work around the messages that you've already received. You're just going to keep going in and getting the same message over and over again if you're going in for the same thing. If you're looking what do you think?
I think that psilocybin often can show us a door. Well, and we still have to have back to our everyday life and walk through it. And so that is work. It's about choosing that path. That could be the path you're on, or it looks like something different. I think it's a good idea to have some intention in going in, and why are we going into this journey, and with microdosing, why are we going to this journey? And it's nice to kind of have the journey. I really like that you all support people on an 8-week journey. Because that's a nice opportunity to get some new skills and practice some mindfulness. And we are always better accountable to other people. I don't know why that is, but it's really helpful. I like to have somebody I'm going to check in with who's going to say, did you actually drink your green tea today, or your green juice, or whatever it is? And sometimes we have to pay people and ask for help to do those things. And once we learn, once you start to get some of those tools, then we can be free and independent with our care of ourselves. And that's really empowering too. And I think that's something that microdosing offers people.
Right.
I don't remember my question. If you.
Oh, we want to hear your question.
Yeah, let's hear
it. So somebody had mentioned that you had mentioned that Heather, that it's not microdosing and psilocybin is not okay for people with psychological disorders such as schizophrenia or bipolar, and that they could actually go into psychosis. What is something?
I was actually talking about large doses, not micro. I don't know about microdosing. If that would be the way I would lean towards doing mushrooms. I think if that were something that needed to happen, would be definitely more on a micro scale than a macro scale, because we are.
It's okay. What happened to the person? What you said, you witnessed somebody go into psychosis from it who had schizophrenia. What does that look like?
Well, there's actually a disorder called, is it post hallucination?
Oh, you're talking about HPPD.
Yes. I can't remember what
that's
that stands
for.
Essentially, it's being in a psychotic state or a delusional state. So in the person I'm talking about had a psychedelic experience and kind of never came out of that psychedelic experience.
So it's a hallucinogen persisting perception disorder.
Yes.
And so with synthetic delta 8.
I think it can happen with lots of things. I just actually had an interesting conversation with a psychiatrist the other night about this, because he was feeling actually I hope I'm going to say this the correct way. In his work that he's done, he's worked a lot with psychedelics in his career too. And he feels that a lot of cases of what we say is ongoing schizophrenia. I mean, he feels like schizophrenia in general tends to be related to some severe trauma that someone's experienced before the age of 5. I don't know if that's true in research because I haven't done that research. I mean, I just had this conversation with him on Tuesday. But so that's kind of a whole interesting way to look at that. I don't know. Like I'm always hopeful that it would be that's HPPD. But I'm not sure if that's the case with this person that I know who those voices in his head turned ugly and not kind. And so it's been a real challenge. And, you know, the risks, and we say this in cannabis work too. I mean, there is a risk for people and it typically is younger men, which schizophrenia tends to affect young men. And most often it comes on at the college age. So a lot of kids, when they go to college, just the stress of leaving home and having this whole new life will be what kind of can bring that on. But so can other things that alter your reality or your perception. So it's very uncommon, but I do want to say that it's also real. And I wish that it wasn't. I wish I could say that it's not, but I don't think that most people are at risk of that. And I don't think that I wouldn't have those concerns about microdosing. So when I said that, it was more about a macro dose in response to that idea of, I think what people are afraid of in the bad trip is that they're going to go crazy and not come back, right? That is what people are asking when they ask about a bad trip. Am I going to have a horrible, awful time and I'll never be the same again? But you might have a really hard time and there'll be some beauty and there'll be some insights and you'll never be the same again because that's the fucking point, right? So anyway, sorry. And then I make it confusing because I'm getting on the macro thing. And so thank you, actually, Quinn, for asking that question so that was clarified.
Right. And I will add to that, we have been doing microdosing with 2 individuals who have bipolar, and it has been going well for them. One of them, I think, was having issues sleeping. They're also coming off of cannabis simultaneously. So in that instance, we just recommended to stop the microdosing for now. So that we're not pushing them like into mania. And Erin, if you want to speak to that.
I don't really have anything I want to share on that right now, but thank you for asking.
Okay. So yeah, but that's all.
I have another question. How does psilocybin compare to ketamine therapy?
Very different.
Have a different mechanism of action in our bodies.
It's a different experience. I think psilocybin gives more of like the deep insight and introspection, where ketamine is really great for your neurotransmitters, right? It can help someone who is in an acute suicidal space, like come out of it, right? And get you right back up to where you can like,
I know it's very cool actually about ketamine,
right?
Because we don't have a lot of options.
Psilocybin,
I mean, it's pretty great.
like that, right? But ketamine, it does something really fascinating in the brain to work in that way. But that doesn't mean that people are getting like a profound insight, and that's why all of a sudden they're not feeling suicidal, right? It's
sometimes they are. Some people are. Sometimes,
but sometimes.
But we know that also just the medicine itself does that. Even if people don't have therapy and support, like if like in our ketamine clinic, we had preparation and we had sessions and then we had support, integration support. So, and people, and then they're coming back on a regular basis. So there's kind of a relationship that's formed, but a lot of ketamine clinics don't do any of that and people are still having really good effects. So it seems to be that the actual substance itself is affecting people's emotional health.
Yeah, what I've had, like the people that I've come to, like that have been curious around microdosing and looking for education around that, like some of them have done ketamine in the past and they feel like they kind of hit a wall and they're not they're not really getting any better
And ketamine's wicked expensive. That's
It's
the other
very
piece.
expensive, but it makes me curious because ketamine can be more dissociative and kind of abstract in a
Mhm.
way,
Mhm.
where psilocybin can be like more in touch with that like the inter experience, and like maybe even like the inner healer in a way, in different aspects that I think that people just get more insight and more like context to work with, where there might not be a whole lot of context with ketamine.
Yeah,
And
I
then
agree.
you don't, you feel so much better. Integration is important. And a lot of people, because of what's been created with ketamine in the infusion clinics and stuff, and integration not being something that's actively just offered or even recommended, it's the thing of that they just end up going for boosters, and then they hit walls, and then they look for other things.
So another question that I had, that's a great point. Another question I had was, we had talked about the propensity for, well, the addiction properties of ketamine. Do you
I worry
do you
about
think
that.
Yeah.
I worry about that too.
I'm just not into white drugs. We're like, I have a hardcore no white drug rule in our family. And so that includes pharmaceuticals, actually, unless you're dying, and then you better run it by me. So that's just our house rule, which is good. But that's actually, I almost didn't work with the ketamine because of that. Didn't want to be kind of glorifying ketamine because I do see it used a lot in party scene.
I've seen it
Um,
pink quite often too, so just yeah, pink ketamine.
Something else in there. I mean, I just think also right now,
But
like,
you said no white.
people should be so fucking cautious before doing any white drugs. I mean,
Yeah, absolutely.
truly,
I
or
definitely
pills,
want to
because
stress.
people we know are dying. So it's like, don't
Yeah,
just like, I
I
know.
definitely want to stress that, doing any kind of medicinal therapy of any sort should be sourced from people, like trustworthy sources. I wouldn't take any ketamine off the freaking streets. I wouldn't. I grow all my own mushrooms, so it's just the reality of this fentanyl epidemic that's happening is like we just don't know, and I mean it's in literally everything, and I still am trying to understand why somebody would be so inclined to put fentanyl in THC. Doesn't make a whole lot of sense to me, but it is happening, and it's not just propaganda. I've had people message me and tell me that their friends that they were with, like they know that they didn't do any opiates that night, and somehow they freaking OD from smoking weed. So I know it's not just propaganda. So please, anybody trying to do any kind of therapy, wherever you get it, whatever you do, like know that there's risks, and
Mhm.
know that the best way to minimize those risks is by getting it from a trustworthy person.
Yeah.
Yep.
Yeah.
All right. And on that note, we got to wrap because Erin's got a call. Somebody just showed up at my house.
Thanks. That was fun. Nice to
Yay!
meet you,
Thanks, guys.
Quinn, and see you,
Thank you, everybody, for
Megan.
watching. Hope you all learned something, some cool things. So, yeah, feel free to message any of us if you have any questions.
Yep,
Bye.
definitely. Bye.